Digestion, digestion, digestion. If you ask any medical herbalist what is the foundation for good health, it's digestion, digestion, digestion. In the same way that if you go to an estate agent and look for a property, they will say location, location, location. So it's that obvious, it's that fundamental. So, what are the common problems that people present with digestive discomfort? And bear in mind that 1/3 of the population has digestive discomfort at any given time. The common problems are indigestion, heartburn, bloating, distension, wind, especially constipation, diarrhea, sometimes alternating constipation and diarrhea, and in the older population, poor function reflected as diverticulosis. So, what we're looking for are herbal actions that will address some of these or most of these problems to improve digestive discomfort. People with ongoing digestive problems often also report low energy, foggy brain, poor concentration, and this can be explained by the enormous connection between brain function and digestive function. If I was to tell you that there is an equal amount by weight of nervous tissue in the gut as there is in the brain, maybe that might surprise you. So if I was to get a weighing scales and put a person's brain in one side of the weighing scales and gather all of their nervous tissue from the gut and put it in the other side of the weighing scales, that they would balance each other out. The problem of constipation is an interesting one because people often have great difficulty, even when they have addressed adequate fibre in their diet, even when they're drinking enough water, even when they're eating the essential fatty acids, they still have problems with digestion. And that is primarily a feature of nervous tone. In addition to providing all of those building blocks for healthy evacuation, you also want to relax the tone in the muscles of the digestive tract. And the herbs do this very nicely. Indigestion and heartburn, you want the demulcent, carminative, nervine, trophorestorative to the mucous membranes. These are all very helpful actions. We often get a whole kind of full house of symptoms with irritable bowel syndrome, where commonly people have alternating constipation or diarrhea, and they alternate with normal stools, a lot of wind, flatulence, discomfort, bloating, and distension. I distinguish between bloating and distension, having listened to people's stories, that bloating is really that sluggish, doughy, heavy feeling like you're not digesting your food properly, and distension is more where you feel like you've swallowed a bag of wind and it's stretching out your tummy and your trousers don't fit between morning and evening commonly. And you almost have that feeling that you wish somebody would stick a pin in your belly and let the air out. And yet at the same time, you can't pass any wind. So it's a very uncomfortable sensation, like a stretching sensation. I always think it's very difficult to be cheerful and happy and ready to smile if your belly is uncomfortable. It really drags people down. It really kind of affects their mood, and it affects their energy levels and their ability to focus and concentrate. So it's really not to be taken lightly. I'd just like to point out that irritable bowel syndrome can include all of those features, but it is a diagnosis of exclusion. If somebody has ongoing chronic or recurrent digestive disturbances, it's very important that they have them checked out. And what happens is they have their blood tests and their scopes up the ways and down the ways, and everything looks normal. The problem is that the function isn't right, the coordination isn't right. It's like the symphony orchestra is playing music, but nobody is following the conductor. They're all just looking at their sheet music. So there is uncoordinated muscular action and poor function in the coordination in the walls of the digestive tract. There's often sluggish bile flow as well, which means that we don't have the benefit of our natural laxatives. Our bile and our digestive enzymes are entering the upper digestive tract after the food has passed through. So there's like intestinal hurry. So we don't have the good effect of the optimum effect of bile and digestive enzymes, which then means that our food isn't well enough broken down in order to assimilate well and in order to pass through the digestive tract in a well-functioning manner. Another common symptom is actually itchy bum, and this drives people distracted. And from clinical experience, it is always a feature of upper digestive function. So the nice thing about the digestive tonic is that the actions of the herbs start from the minute you take them into your mouth. The bitter effect will be having a benefit, but the herbs have an action all the way down through the digestive tract. If people have poor digestive function on an ongoing basis, taking a probiotic regularly throughout all the period of discomfort is very important, because I would almost say that by definition that poor functioning digestive tracts always either have an effect or reflect poor microbial flora in the digestive tract. In addition to the herbs that we'll go on to mention, I would also like to pay a special tribute to slippery elm. Slippery elm is soothing, demulcent. It comes in a powder. It's the inner bark of the elm tree, and it has a normalizing capacity, particularly for patients who alternate between constipation and diarrhea, although it can be helpful for both separately. And you might think that's a contradiction, but in fact it has a very soft fibre because it's the inner bark of a tree, which helps as a very gentle, soft bulking agent. And because it is a soft bark fibre, it will also absorb excess moisture in the lower bowel and help firm up a loose stool. It is also nourishing for the mucous membranes, and it is a good balancing influence on the normal gut flora. So I can't praise it strongly enough, and it can be used with both the digestive tonic and the digestive tea. So for indigestion, heartburn, irritable bowel syndrome, leaky gut, which is a bigger topic, but is characterized by all of these symptoms, and itchy bottom, diverticulitis. Diverticulitis is where there is a reflection of poor muscle tone in the digestive tract, and you get small pouches of gathered old fecal material, which needs to be drawn out, and the nerve and muscle functioning improved. And it affects the older population. Just for information, diverticulitis is when there is an infection in these little pouches, which can cause quite severe illnesses and needs medical attention. I'd also like to note that these blends of herbs and tinctures and teas are most suitable for mild to moderate problems. If somebody has severe irritable bowel, there's no problem with them using them and gaining benefit, but I really think by the time they would use them for the length and duration of time that it would take to calm down significant dysfunction and discoordination, that they would be better served by seeing a medical herbalist and having an individual blend made for their particular problems, and also the mentoring and advice that would come with that. I hope that's helpful. You're not going to be surprised to find chamomile in their top of the list. Remember, it's antispasmodic, slightly bitter, soothing for the digestive tract, and also the interaction between the digestive tract and the gut, and also anti-allergy. So that's a wonderful herb to have in a digestive blend. The fennel is carminative, so it's soothing, it's aromatic, which has those volatile oils, that lovely smell of fennel tea. Antispasmodic, it promotes a healthy appetite. It's a soothing diuretic. So a lot of people with irritable bowel also have that bloaty feeling. So the diuretic would be good for that. And it's anti-inflammatory. Marshmallow leaf, you remember, is that soft, downy, marshmallowy softness, which has a demulcent, soothing action on the mucous membranes itself. Peppermint is a very good carminative and aromatic digestive, particularly good for wind, and especially in conjunction with fennel. Meadowsweet is specifically stomachic and pain relieving. It has salicylic acid. It is anti-inflammatory also. With the salicylic acid, which is the same analgesic effect as aspirin, which is acetylsalicylic acid, the aspirin in the meadowsweet is like a pro-aspirin. It's not metabolized directly in a way that's inflammatory to the gut or harmful to the gut. That makes it a very useful to have both the salicylic acid pain relieving effect in a herb which is also soothing for the stomach, I think is a very rounded action for digestive problems. So these are the tonic blends that are in the bottles. I find that it's very useful, particularly for flare-ups of irritable bowel syndrome, for ongoing soothing of diverticulitis. It can be used for any inflammatory condition of the gut. Very nice, very safe herbs. The other thing to mention is if somebody has a sensitivity to salicylic acid, one should just be aware that this can also occur with herbs that contain salicylic acid. Salicylic acid can present with bronchospasm or wheeze in the respiratory tract. In 14 years of using the herbs, I haven't encountered it, but it's just something to be mindful of. It hasn't been reported with Meadowsweet, but it's something to be mindful of. Also, avoid herbs with salicylic acid in children under the age of 16, because in conjunction with a viral illness, it can present a serious, if very rare, presentation syndrome. So not indicated for children if it contains salicylic acid. So something to be mindful of, but which hasn't been reported in humans. The digestive tea has all of the same herbs as the digestive tonic, and that's because the herbs work so well for the digestion. It can be used in conjunction with the digestive tonic. It's particularly useful for irritable bowel syndrome and anybody who has a tendency to irritable bowel syndrome, for keeping the digestion nice and calm and happy, so that it takes a lot more stress in order to precipitate the actual symptoms of irritable bowel syndrome. The herbs in the digestive tea should be used long term if people have this tendency. By long term, I mean that it's generally recommended to use 3 teaspoons a day for 3 months and then to take 3 weeks off. And that's a pragmatic idea, which is to allow the tissues to rest. If they have no symptoms at all within those 3 weeks, then go back to using the digestive tea just as a pleasant after dinner tea, which can be in fact enjoyed by everybody. So calming, antispasmodic, carminative, soothing, demulcent, analgesic, and an overall relaxing tonic for the digestive system and therefore stress reducing for the nervous system. A tea to be enjoyed by all and to be enjoyed regularly by people who have a tendency to digestive upset, irritable bowel. Can also safely be used for diverticulosis. It can be used for diverticulitis, which is a flare-up for which people might need antibiotics or other treatment. And these teas are all fine for that. It can be used as a tea for any condition where the digestion is a problem. Even if the problems are menopause and somebody has a digestive problem, it's always important to treat the digestion as a fundamental aspect of treating any condition. So this is another place where the digestive tea really comes into its own, particularly in conjunction with the slippery elm, as I've mentioned. For any treatment, whether it's allergies, whether it's migraine, whether it's stress, whether it's arthritis, memory problems, energy, focus, fatigue, all of these things, if there's a digestive problem, a fundamental to treating all of these conditions is actually treating an upset digestive tract. And the tea is really a very low cost, easy to involve people with taking the teas on a regular basis.